Welcome back to the Aesthetic Edit, and I have Kama here today. We wanted to chat a little bit about bioidentical hormone therapy, one of our big therapies we offer here at Omni Centers. And her story is pretty remarkable, the transformation that she experienced. And what we've seen in the past year with bioidentical hormones is the black box warning came off from the FDA. They have dispelled we can now call a myth, but there was a study done back in 2002 that said estrogen causes cancer. The truth about that is the study was done on Premarin, which is a estrogen that was derived from horse urine, and it isn't compatible with human biology. And that's what was given to women back then. And then the study came out, and then everyone was taken off it, and many doctors did not want to treat women with bioidentical hormone replacement. And that's gone away. And with the knowledge and the studies now that has been going on, the benefits of bioidentical hormone therapy are tremendous. And I'll go into a little bit about that, but I wanted Kama to have a chance to share her story because it was remarkable.
Well, from the beginning, my mom made me feel really scared about hormones. My mom has never been on hormones because the hormones that were available to her were the ones you're speaking of. They were the ones that were lab created, that were unhealthy, that maybe caused cancer. That was what the research was showing. So it was in my mind that I was never going to take hormones because my mom didn't. And so I think that was probably a bad idea because what happens when you go through menopause is that everything changes. All your body functions, your digestion, your hair, your skin, everything changes. And you think this is just what it is to get. This is normal.
Such a lie.
And so when I came to work for Omni Centers and I learned a little bit about bioidentical hormones, it opened my eyes to the possibility that maybe I was misinformed, or maybe it was just the best information we had at the time. And so I resisted for quite a long time. I didn't go on any kind of hormone therapy, but then I just felt like I needed to do something. My body wasn't functioning properly. And so I went through the process of that Dr. Lauren does. And it was okay if I tell about how I went through that. So the first thing that Dr. Lauren does, and this is why I highly respect her as a doctor, is that she doesn't just stick stuff in your body. She makes sure that she checks all the levels. I went in for lab work, and the lab work came back and it showed where I needed it. I literally had non-existent hormones in my body. She was negative. There was nothing working for me.
And doctors will call that normal for someone that's in menopause,
but not optimal. Yes. And so Dr. Lauren, what I opted for, I'm just not the person that's going to remember to put lotions on my body, to put the creams on. I think that's what you use. But I knew that I would fail and I probably wouldn't get the best results if I did that. So I opted for the pellet insertion, and I was scared. It took me over probably a year and a half to allow Dr. Lauren to do this. But I was like, I just have to do it. One of my friends had done the pellet insertion, and you do hormone therapy? And she's like, that's totally changed my life. And so it gave me the courage to talk to Lauren and go through this process. And then when she did the pellet insertion, of course, she looks at your levels and she puts in what you need. And it wasn't scary at all. It was just, I felt nothing.
It's quick,
It was so quick. It was in and out. And within 2 weeks, I was like, I feel
the clouds
parted. I feel
the sun came in, just birds were singing.
And honestly, just to be real here, we're women here, we're doing this to help women. My sex drive was at negative. I had no sex drive whatsoever. I have a very lovely husband, and I literally didn't want sex. It wasn't that I didn't want him, I didn't have any physical sexual drive, none.
And I didn't have any hormones.
I had no hormones. And so within a couple of weeks, I started feeling like I wanted to have that with my husband. It's not that I didn't have it, but it was like, we'll do this. But when I had the hormone balance, all of a sudden I felt more connected to my husband. I felt bonded. I felt physically better. Everyone tells me how great my hair is. I wish it was down so you could see how thick and wonderful it is. But I don't think it would be so nice post-menopause if I wasn't on hormones. People think, oh, I thought when you went through menopause, your hormone levels just made your hair fall out. And my hair was definitely thinner before.
Hair does react to hormones. I want to just speak to that really quickly because there's a lot of information out there saying, oh, I went on estrogen therapy and I started losing my hair. The optimization of hormone and the way Dr. Lauren does it, and she's been doing this now into her second decade, Optimizing hormones this is the optimal level. It's unique to each person.
Right.
And if we optimize the levels and we're monitoring you as you're going through your hormone therapy, you will actually see your hair return, not the opposite. So there's something,
Yes.
and a lot of doctors, they don't always understand it, or they feel for their patient, they're dealing with the symptoms, the hot flashes, the brain fog, the sleepless nights. So here's an estrogen patch and send them on away.
Can't we just prevent it before it gets to that point?
Well, I can speak to that too, because it's really important. But if you're looking at not just their estrogen, she's looking at estrogen, progesterone, your thyroid, your testosterone, and we get these into a harmonious balance for you.
Right.
Your body is going to function better. Estrogen is not just a sex hormone. There is receptors on every cell in the body, including your brain, and the loss of that estrogen impacts cellular function.
Right.
And so if we optimize you, you are going to feel it. And your body's processes are going to return and operate in a much better state.
For sure.
The other thing that's really important, and I've gotten incredibly passionate about this, is that what we know now is if bioidentical hormone therapy is introduced at the menopause time, it's a small window, that if we start balancing and helping people through this transition, we're going to protect their heart, we're going to protect their skin, we're going to protect their bone, we're going to help their brain function. If you get into bioidentical hormone therapy later, it's still beneficial. However, you miss those cardiovascular protection, you miss the bone protection, but there are other benefits. So for me, it's important, if a woman is looking into this, it's important at this time to start doing it, because that window does close, and once you're past it, you miss that opportunity. So it's the benefits. Are there risks? There's risks to everything. You go on a bike ride, you can fall. Getting in your car. So you have to talk with your doctor. And Dr. Lauren is phenomenal. Is this beneficial? Does the risk outweigh?
Right. And so the other thing that I wanted to make sure we talked about is that once you do the lab work, she does the pellet insertion specific to your body and your needs, and then you come back a few weeks later and she tests to make sure that your body assimilated those hormones
properly.
properly.
A lot of testing.
It is time released over a period of time. So then the next time you go in, every time you're going to get lab work, Dr. Lauren is not going to put pellets in your body.
Sometimes twice.
Yes.
In the beginning, twice.
Right, because she doesn't know how your body's going to do, so she
Right.
wants to make sure that she's doing exactly what she needs to do for you. And that's what I loved, is that after the pellet insertion a couple weeks later, when I was feeling better, she still did the blood work to make sure that that was the right dosage and everything that my body, because everybody's body metabolizes differently.
Sure.
And then the next time you need to come in to redo it, we're doing lab work again. We're doing the insertion or the creams, whatever you opt for. And then you're going to get lab work a couple weeks later. So it's a constant state of adjusting for your body, because we're changing as we go on it too.
It stabilizes, and she then reduces the amount of lab work she requires. But some patients have been upset about how much we do. And I'm like, this is optimization. You want to know. That's the only way we're really going to know. And so once you're going along and you're feeling good and she's checking in and things feel great, she'll reduce the amount of
Because now she's seen how your body
we have a data baseline.
And I think that's super important, because I think a lot of times the doctors just say, it's just the same thing that they give all their patients. There's no personalization for that person's body. And we all know how we all react to different drugs, different foods, different everything. Why wouldn't we react differently to bioidentical hormones?
Yep.
So, but as far as the sex drive goes, that was the first thing I noticed. It wasn't the only thing I noticed. And I have to say that it just makes me feel more like a woman, and I know that sounds really crazy, but
no, it doesn't.
I feel more like a woman when I feel like my body is responding in the way that God made us to respond.
So sexual wellness has not been something that's often discussed, because it's in some cases taboo. It's not something that doctors will talk with their patients about. But sexual wellness is important. It's important for long-term marriage. It's important for self-confidence and feeling good about yourself. So there's nothing wrong with that, and having that connection and feeling sexy.
I don't feel broken anymore. I felt like my body was broken, and now I just feel whole.
You make me want to cry when you say that.
No, I did. I felt like, well, it makes me cry too. I felt emotionally and physically, I just wasn't myself anymore. And the hormones literally changed that for me. And actually, Monday, I'm getting another one.
Time for your insertion.
But I also think that to know that bioidentical is really the key word here. It's not a one size fits all.
And there's oral hormones Dr. does not prescribe. Dr. Lauren does not prescribe because that does increase the risks involved. So she's topical and pellet and a troche progesterone. And again, it's not, like you said, it's not a one size fits all. In some cases, it may take at least 2 or 3 to really get where someone is. And we've had that experience with a patient. This is another thing. In some cultures, they call it the 50-year shoulder, and women experience joint pain as this estrogen goes, and it's an accepted where they can't raise their arms anymore. They hit that.
It's just aging.
It's a loss of estrogen. And what's really amazing is that can be corrected with proper BHRT.
Right.
So, and we have a testimonial, which you could put up again, of one of our patients who was gracious. She was fit, exercised her whole life, and she was dealing with joint pain. And it was through our program here that went away. And she's like, I am convinced this is where I'm going for the rest of my life.
And I also feel like it's a great partner with doing proper skincare, self-care, because I'm going to be 64 this month. And
Damn, girl, you look good.
And I feel like my skin is supple, and I really don't think it's just the skincare and the treatments I'm doing. I think it's the whole body perspective.
Estrogen protects the collagen and elastin, and at the loss of estrogen, the skin begins to become frail. The elastin breaks down, and it can no longer have its buoyancy. There is the aging process, which science is getting closer and closer to being able to reverse it. But estrogen absolutely protects your hair, your skin, your bones, your heart, your libido.
I'm a new woman, and I won't ever just listen to the noise. I want to hear it from a doctor, and I want to do my own research, and the BHRT is definitely
and it's changing. And then what I will say is Dr. Lauren stays on top of what is the current findings. It's changing ongoingly, how to go about it, how much, appropriate ages, and things like that.
I think the biggest contrast for me, obviously I noticed the libido came back first. That was just my first physical, things feel different.
Dave was like, woohoo!
But I think that, and I also noticed that my libido definitely takes a big dip when it's time for me to get the next insertion. So that's when I'm like, I think maybe I should go get my levels checked again. But I think probably the other things that I noticed was that I was feeling just more rested. I was feeling like my hair looked full and luscious. My skin was starting to look like more supple. It would bounce back more. I would say that it probably took a good 2 full rounds of hormones for me to really see all the other benefits. The libido was the thing that happened first and carried through. But the rest of the stuff, it took a while for my hair to fill in a little bit more and get thicker. It took a while for my skin to repair and have more buoyancy. So I would say it was a good 8 months or so for me for the full effect.
So what we see typically is most people start to feel it in 2 to 3 weeks. They start to see that change. Some people, it's taken as long as 10 weeks. But as your body adjusts to the hormones in your body, those physical processes change. So it is a journey, but most people, I would say, is 2 to 3 weeks. Some
You
people
can't
longer.
skip those follow-up labs after the insertion. You can't.
Unless doctor says you can.
Well, obviously,
Yeah.
but especially the first time. That's to optimize it. Because if that first time, and she's like, well, your body really ate that part of the hormone up. Next time, I'm going to give you a little bit more so we can adjust that. Like you said, once you get to the point where she can stabilize, then it's smooth sailing. But it's still really important to know that if you get the pellet insertion and you're feeling good, still come in for the checkup after that first insertion. I'm not a very large person to start with, but I always have this extra 7 pounds on me. And when I started the hormone therapy, I found that I was still doing the same things. Maybe I increased my exercise a tiny bit, but it wasn't enough to drop the weight. And last time I got my pellet insertion, I really noticed it, that the weight just came off, and I'm stabilized now. So the weight does come on a little bit more when you're not balanced properly.
Or too much. So I didn't mention this, but lean mass protection comes alongside with testosterone. Of course, you still have to exercise. You don't take bioidentical hormones and suddenly you're jacked.
Right.
However, it does protect your lean mass, and so it's important. And that's what women see. They see this weight gain as they lose their estrogen, lose their hormones. So it's more than just one thing, and there's more than one therapy. So there's peptide therapy, which absolutely gets underneath hormones and supports it. But lean mass protection, and that's incredibly important as you age, is to have healthy skeletal mass. That's what preserves our metabolism, and that's what's a piece of the longevity pie.
But I think people just expect that when they go through menopause, they're going to get the tummy, they're going to get the extra weight, and they're going to well, I look good for my age. But no, we
Never say that.
We have to throw that out, because I feel like at 64, I feel like I look better than I did when I was 40.
You do. I've seen your pictures. And who is that?
I know, you're like, who is that? That's literally me, and you were shocked. But I completely owe it to Omni Centers. I'm not kidding. It totally changed my life from head to toe and inside.
That's why we're here. Make a difference. You don't have to just take things status quo. So thanks for listening in. Aesthetic Edit.